Difference between bacterial meningitis and bronchiolitis. Look at this picture, shows that bacterial meningitis and bronchiolitis X-ray findings, detail going on. Bacterial meningitis. It is a serious and potentially life-threatening infection of the protective membranes covering the brain and spinal cord caused by bacteria. Bronchiolitis is a common respiratory infection that primarily affects infants and young children, causing inflammation and congestion in the small airways, bronchioles of the lungs, often due to viral infections like respiratory syncytial virus (RSV). Difference between one definition: bacterial meningitis, an infection of the protective membranes covering the brain and spinal cord caused by bacteria. Bronchiolitis, a respiratory infection affecting the small airways in the lungs, typically caused by virus, most commonly respiratory syncytial virus. Two causative agents: bacterial meningitis caused by bacteria such as Neisseria meningitidis, Streptococcus pneumonia, Haemophilus influenzae. Bronchiolitis caused by virus, primarily RSV, but can also be caused by other virus like influenza or adenovirus. Three affected areas. Bacterial meningitis affects the central nervous system, particularly the meninges. Bronchiolitis affects the lower respiratory tract, specifically the bronchioles. For common age group, bronchial meningitis can affect all age group, but is more common in infants, young children and the elderly. Bronchiolitis primarily affects infants and young children under 2 years of age. High transmission. Bacterial meningitis spread through respiratory droplets from coughing or sneezing, close contact, or sharing utensils. Bronchiolitis spread through respiratory droplets, direct contact with contaminated surfaces, or close contact with an infected person. 6 symptoms: bacterial meningitis, high fever, severe headache, stiff neck, sensitivity to light, nausea, vomiting, altered mental status, and rash. Bronchiolitis: coughing, wheezing, shortness of breath, rapid breathing, nasal congestion, and fever. 7. Severity. Bacterial meningitis, a medical emergency that can be life-threatening. or cause permanent damage if not treated promptly. Bronchiolitis usually self-limiting but can be severe in infants and those with underlying health conditions. Treatment. Bacterial meningitis requires prompt antibiotic treatment, sometimes corticosteroids, and supportive care. Bronchiolitis, primarily supportive care, including hydration, oxygen therapy, and sometimes antiviral medications. Nine complications: bacterial meningitis, hearing loss, brain damage, seizures, learning disabilities, and death. Bronchiolitis, respiratory failure, dehydration, and severe cases. Hospitalization may be needed. 10. Diagnostic test: bacterial meningitis, lumbar puncture. To analyze cerebrospinal fluid, blood cultures, and imaging studies. Bronchiolitis, clinical diagnosis based on symptoms, sometimes confirmed with viral testing or chest X-ray. 11. Vaccination. Bacterial meningitis vaccinations are available against common causative bacteria like Neisseria meningitidis, Streptococcus pneumonia, and Haemophilus influenzae. Type B HIV. Bacteriolitis, no specific vaccine, but prevention strategies include hand hygiene and avoiding contact with infected individuals. 12. Prognosis. Bacterial meningitis can be fatal or cause severe complications if not treated early. However, with prompt treatment, many recover. Bronchiolitis, most children recover fully with supportive care, though it can lead to recurrent wheezing or asthma in some cases. 13. Seasonal occurrences. Bacterial meningitis can occur year round but may have high incidence in winter and early spring. Bacteriolitis most common in the fall and winter months. 14. Hospitalization. Bacterial meningitis almost always requires hospitalization for treatment and monitoring. Bronchiolitis, hospitalization may be necessary for severe cases, especially in infants. 15. Prevention. Bacterial meningitis vaccination, avoiding close contact with infected individuals and practicing good hygiene. Bronchiolitis, hand hygiene, avoiding smoking around children and limiting exposure to sick individuals. Thank you. Have a nice day.